Dr. Harriet Okatch is our speaker for today. She's currently an associate professor of public health at Thomas Jefferson University. She earned her Bachelor in Science and PhD in Analytical Chemistry from the University of Botswana and an MPH from the University of Pennsylvania. Her current research focuses on the prevention of childhood lead poisoning through education, residential interventions, and policy. In this work, she collaborates with healthcare facilities, nonprofits, and local governmental agencies. She conducts this work in Lancaster and globally in both Botswana and the Dominican Republic. Dr. Okatch teaches epidemiology and environmental health in the MPH program at Thomas Jefferson University, and is a member of the Lancaster Lead Coalition, the Lead Free Promise Project, and the Philadelphia Regional Center for Children's Environmental Health. She will talk with us today on identifying and addressing lead exposure knowledge gaps.
Just to confirm, can you see the screen?
Yes.
Okay, perfect. Okay, so my presentation today is going to be focusing on one subset of research that I do. As per the introduction, I'm very much interested in different areas around lead exposure and lead poisoning prevention. I look at this from an educational perspective. I also look at it from what are the preventative interventions we can put into place, and also from a policy lens. And so today, this is just a small slither of some of the work that I've done that I'd like to share with you. And I just want to appreciate all of you for taking time off today to come and listen to me. I'm very grateful for that, because it's kind of that little motivation that you need to know that what you're doing is really important. And so I appreciate your presence here. I do not take it lightly. So I'm going to start off by just some background that I feel a lot of us present in this room are probably aware of, but it's just going to be some background around this issue of lead exposure and lead poisoning. So if we look in the United States, this is data from our World in Data, and these data are showing that over the last 50 years, we've seen a tremendous decrease in elevated blood lead levels in the US. And we've gone down to levels that are less than 5 micrograms per deciliter. And while we might want to applaud this, there's real concern, because we still see impacts and negative adverse effects of elevated blood lead levels in children. So regardless of these progress and successes that we've made, we still need to pay attention to that continuously vulnerable group of children who are still being exposed to lead. And especially because this is something that is completely preventative, it really does beg to question why we still have such elevated levels. So some of the risk factors that continue to persist in the US related to elevated blood lead levels is, one, we have some old housing in the USA, and most of these housing was painted with lead paint. And so as homes get older and as they deteriorate, there's lead dust which is formed, and that lead dust, upon exposure to children, is going to result in elevated blood lead levels. We also find that a lot of individuals who are renting versus those who own homes at higher risk of elevated blood lead levels, and that's just because they do not have the autonomy or even the motivation to make changes in a home and make it more lead safe. Socioeconomic status as well, we find that low-income families are typically the ones who are living in these older homes and will have elevated blood lead levels. And I talk about race, not necessarily as in the way we categorize it in the census, but race is a risk factor in the, in the way that it is the lived experiences that one is exposed to because of their race that is really a risk factor for elevated blood lead levels, and not necessarily the race. So why is this important? Like I said, it's a small group of individuals, but we see in young children that there are delays in them reaching their milestones, developmental milestones, if they're exposed to elevated blood lead levels. In children who are school age going, we see losses in IQ points, and we're beginning to see some evidence that is suggestive of neurodevelopmental deficits, which will result in things like ADHD and the autism spectrum disorder. At high school or in advanced schooling rates, we're seeing adolescents with issues with impulse control and also with high school dropout rates. And in adults, we are seeing, studies that are suggestive of high rates of cardiovascular and renal disease. We also see that these individuals are less likely to be engaged in the workforce, and if so, with lower productivity. But for pregnant persons as well, there's in utero lead exposure. And then there's also evidence that is suggestive of neurodegenerative disorders in the elderly population. So lead really is a condition, lead exposure and the impacts of it is across the lifetime. So while we focus on blood lead levels in young children, the implication is that once exposed at a young age, their trajectory is going to be impacted in terms of development. And also in the in utero, we are very concerned about in utero exposure for the child from a mother who was exposed in their own infancy. So that's just the background that I feel a lot of us have access to that information. So what I want to do now is talk about some of my foundational research that really got me to think about the importance of education in the area of lead exposure and lead poisoning prevention. So in 2017, I was working at Franklin and Marshall College in Lancaster and was thinking about research areas. And one of the things that showed up in my search of literature and data and speaking with community members was that Lancaster has a very high prevalence of elevated blood lead levels in comparison to the state in general. And so this table there is showing across the years from 2015 to 2020, the prevalence of elevated blood lead levels greater than 5 micrograms per deciliter in Pennsylvania and in Lancaster. And you can see that Lancaster is always about 1.5 to 2 times higher in terms of prevalence compared to Pennsylvania. And this map here is showing, the city of Lancaster right there. This is the whole county, but in the city, the color there, the red color is brownish, beige, brown, orangish, reddish colors. Those are showing levels where there's higher prevalence of elevated blood lead levels. And the city of Lancaster is one of those hotspots for elevated blood lead levels. And so I decided to, focus my work on trying to understand why are the levels so much higher in Lancaster than in the rest of Pennsylvania. And so in doing this, I had conversations with different organizations. The County of Lancaster does not have a public health department. And so a lot of organizations are really involved in, trying to address the aspects of lead exposure, but in a way that impact the direct population that they're working with. So in conversations with these different organizations, I learned that there is a lot of educational material about lead and lead poisoning prevention in Lancaster. I also learned that at that point, there was a grant that the city had for $1.3 million. And then there was the Lancaster Lead Coalition, which was a group of individuals who got together once a month to kind of brainstorm and think about ways that organizations that work in their own spaces can actually come together and begin to generate solutions that could be widespread and have more impact. And the city of Lancaster had in place some ordinances for homes that had lead in them and what the requirements were for the landlord. So there was a lot that was already being done in this area. And so that disconnect for me made me wonder that there's so much that is being done and yet the levels continue to be high. And that's when I decided that I was going to try and understand, why do we persistently see high levels of high blood lead levels in Lancaster. So I did this by just talking to a lot of individuals, community members, people in different professions who serve families that were at risk of elevated blood lead levels. And what we learned from those two studies was that there's information that is very varied. For example, when you look at sources of lead, some people had really accurate information about what the sources of lead were, and there was some information that was inaccurate. When we thought about where individuals are getting their information from, the responses was that some of it we're really getting information from validated, trusted individuals like healthcare providers or organizations like Women, Infants, and Children. But we also had some sources that may or may not be validated, like social media, right, where there can be misinformation, both intentionally and unintentionally. And then in terms of action, like what are individuals doing to maybe increase their knowledge level or protect their children from exposure, what we're learning is that, some families were applying for the lead hazard grant that the city of Lancaster had, but those were families that typically already had a child who had tested positive or knew of someone who had a child who had screened positive. And then a lot of the interviewees that we spoke to said that they felt like their doctors or the landlord or the government should be taking the necessary action to prevent this. So there was that heterogeneity in the information that we were seeing, but we also learned that these low knowledge levels were of concern, especially to organizations that provide services to families that are at risk. And then we also learned that, if individuals have agency to change their behavior, they're most likely going to do that. So going back to the earlier on when I said that there was educational material in Lancaster, I wondered why that educational material was there, but then we're still having low knowledge levels. And so on that basis, just asking what is going on with this, and coupled with the fact that we know that medical information at a public school, for the public, should be prepared at an 8th grade reading level. And this is because we understand as a population that that grade level that you're in does not necessarily mean that that's the literacy level that you have. And in fact, we're typically a literacy level of 2 grades lower than the grade that we're actually in. But more importantly, in the USA, 20% of the population reads below a 5th grade reading level. So I wondered if the reason why these educational materials were there, but knowledge levels about lead were still low, was that maybe the material was not being prepared at a reading level that was commensurate for the population. And so we did a study to investigate whether these educational materials were comprehensible, and we got information from the city of Lancaster in the brochures that they use from different organizations that are represented within the Lancaster-led coalition. We were able to pull those out, and also we just went to the website to see what the state of Pennsylvania recommends for lead poisoning, like what educational materials they have. And then just using Microsoft Word with the Flesch-Kincaid readability level tool, we were able to assess what those readability levels were. And so we looked at 12 different pieces of materials that had been prepared. And what we actually find is that these materials are prepared at a mean reading level of a 6th grade. So 6th grade reading level is the mean level for all these different documents. And what was really interesting and really nice to see was that these levels did not exceed that 8th grade reading level, which is what is recommended by health authorities. So we had good reading levels, and then we asked ourselves, what are the content in those materials? And we find that for the most part, when you're thinking about exposures, 90% of those touched on lead-based paint. And there are all these other exposures that we know of that I have there in the bar chart. And you can see that for most of them, at least 40% of the articles covered those different lead exposures. We also looked at the same thing for prevention, and residential lead remediation was mentioned in 90% of those articles. 40% talked about nutrition, and another 40% talked specifically about cleaning. So what were our key takeaways from here is that there were some challenges, even though we know that, reading levels have to be at 8th grade reading level. We had 25% of them being less than a 5th grade reading level, but we started thinking about why do we still see a very low knowledge level amongst residents in Lancaster? And it could just be that we have challenges with accessing these materials. Some of them we downloaded from the internet, and it begs to wonder whether everybody actually does have access to the internet. So it started making us think about this idea of access, equitable access to these materials that can actually be protective when we think about lead exposures. And so our next question was then, how do we educate equitably? So that led us to a point where we now had some foundational information and started to think about what is the action, what are the active steps that we're going to take. And to think about some of these active action steps, I had to think about the environmental health literacy, which tells us that we really want individuals to be knowledgeable enough and have the capabilities to make informed decisions about environmental exposures and how those exposures can actually affect their health. And once they have that information, they should be able to act on that information. They should be able to engage in conversation, in dialogue, and even have advocacy skills in that case, right? So when we're thinking about environmental health literacy, it's really the idea of knowledge acquisition. What are the attitudes that one has towards this environmental issue? So disposition, what are the skills that they would need? And then can those skills be translated into behavior? So taking that foundational knowledge and having this framework in mind made me then think about, maybe we need to think about developing a curriculum. And as we develop that curriculum, think about what is the age group that we want to be able to deliver this curriculum to. And so we landed on focusing on an early age group and maybe thinking about fourth, fifth graders. And that's the reason why we wanted to focus on fourth and fifth graders is because they're very impressionable. But with them, they also have this take back knowledge where I always tell people when my kids were in elementary school, they would come home and tell me, guess what we learned at school? And they would say all these other things. And then they get to some point in middle school and you ask, how was school today? And they're like, fine. What did you do? And they say nothing. So I was like, okay, let's avoid this middle school age and focus on later elementary school age going students. And really the idea is that if you learn something in youth very early on in life, there are many opportunities for you to hear that information again. And just like vaccines and boosters, thinking about this higher likelihood of repeat exposure is going to ingrain the skills that we need and the competencies to see behaviors that are aligned with prevention. So we then decided to do this curriculum development, and then we had to identify a partner for that. And so we identified Brightside Opportunities Center, which is a non-governmental organization that is situated in Lancaster. And their mission is really to uplift and empower individuals in that community. And they do it in different ways. So you can think about food access. They have services for senior individuals. They have a lot of youth camps. And so this conversation started in the summer and fall of 2023, and unfortunately, they don't work with the fourth and fifth school age. They work with middle schoolers for their STEM camps. They have STEM camps for 1 or 2 weeks, and it's just specifically middle school students. And they always have a great number of facilitators there to make sure that the ratio of educators to students is one that is really going to be optimal for learning. So we put in a proposal to do this work to PRCCEH, and we got funded for that. And so in 2024, this is the timeline that shows how the curriculum was developed. We this was with Isaiah Perry at Brightside Opportunities to kind of get what excites students who enroll in the STEM programs at BSOC. And then from my perspective as the person designing the curriculum, thinking about what is the content. And obviously we wanted to educate about sources, risk factors, prevention and screening, but also what is the context. So originally when I thought about this, I wanted fourth and fifth graders, but now I had to make sure that that information as displayed here would be age appropriate for middle schoolers, but also contextually relevant when we think about the city of Lancaster. And so in doing this, I was able to obviously pull from peer-reviewed work that's been published. I was able to pull from other institutions that have created materials for lead poisoning, but I was also able to pull from some of the work that I had done in Lancaster. So on the left, that's working with a high school student. We were analyzing lead levels in soil. And on the right there, I worked with college students to analyze lead levels in different spices. So this is a cross-sectional view of the curriculum that we finished, and we had morning and afternoon sessions, and every session had a particular focus. And you can see the first morning we were just doing a pre-lead testing and doing the registration, setting the tone. What are the rules for this, camp? And then in the afternoon, that's when we started talking about lead. And so this is just like a cross-sectional view of it. So what I'm going to do now is just pull out different things to demonstrate some of what was in the curriculum. Oh, before I do that, actually, I had to train the facilitators. These were all attending colleges. They were either in their sophomore or junior year of college in different disciplines. Some of them did not have high levels of lead. And so for them to be facilitators in this program, I had to train them. So in June, we did a one-day training, and they had access to the materials before the training. And we came in and I gave a few lectures, and we did a lot of discussions just to hear what their thoughts were, their curiosity, and the questions that they had. So then in July of 2024, we rolled out this curriculum. So this is an example of what, this is just a screenshot from the curriculum. And this was the first exercise where we were introducing the students to lead. And there are a lot of instructions there for the facilitator, what they're going to say, just to give them an idea and help them along. It was a lot of, for BSOC, there was a lot of empowering that they wanted to do. And so I designed it in such a way that they could do the facilitation of the session, and I would be in the room to answer any questions that they might have or to re-guide them if I felt that they were not going in the direction that they wanted to go, that I needed them to go in. And so in this case here, I created a display, a gallery, and I had different items in there. And the whole exercise was that I showed them lead pellets. We showed the students lead pellets. And then after showing them lead pellets, which are gray and heavy, we then asked them, of these 25 items, which ones do you think contains lead? And then subsequently, we reviewed those responses with them. And then they did a second round of that. And the responses from the first round to the second round were aligned with them having actually seen and kind of realize, oh, where did I get this wrong? Where did I not get this wrong? And so this here is our display. You might not be able to see everything, but we have a laptop, we have this gasoline can, we have paper towels. This is rice and beetroots. We have some cosmetic products, some water pipes there. We have some clothes, some body lotion. I think these are just twigs, pots and pans. I had paint, a ceramic bowl, and this was a window that had just been taken out of a house that was being abated for lead. And they wrapped it all up for me and they brought it to the venue so that the students could look. And this was water here. There's some medication, some pictures, some soil, and shoes. So we really wanted to have some things that definitely didn't have lead and some that had lead. And then we created conversations around that, and the students had another chance to go back and now re-identify. For risk factors, I gave the brief lecture about what are some of the risk factors, what can we control, what can we not control, what are some of the historic ones versus the current risk factors. And then for the activity, the students had, 6 different scenarios, and they had to work in groups of 2 or 3, and in those groups, they had to indicate which of these was a high, medium, or low risk factor for lead poisoning, and they had to provide the justification for it. So this is just an example of that activity. And then on the second day, we had the students collect soil samples, and they worked in groups of 4, and these were the instructions. And you can see I still have the names of the facilitators up there, who was facilitating which session. And they walked with the students to make sure that the samples were collected. We also wanted to include not just about lead, but other aspects. So here we had the students think about what is good data collection? How do we document our processes and procedures? So they had this worksheet that they had to write everything into. And then on the next day, we took those soil samples to F&M College, and we had them actually do the analysis of those soil samples. We had a geologist with us there, Dr. Ismat, who helped us with these analyses. And none of the samples exceeded the EPA levels for lead in soil. And what was really interesting was we had talked about lead not being in community garden soils. And on this property, there were some community gardens, and the soil in there had undetectable levels of lead. So I think for the students and the learning, that was really impactful to see that. For prevention, I gave a lecture, and then after the lecture, we had the students do an exercise where they were given $500 and they had to do shopping for the family, a family with 2 children, one 3 years, one 6 years old, and they had to determine what they would buy. And it was so interesting with the middle school students, even though they had this list of the foods that help protect against lead, or they wanted to buy popcorn and they wanted to buy crisps and they wanted, like they had all these additional things that they added to their list, but they did also include foods that were protective against lead. So it was great to see the reality of it that, yeah, I'm going to eat healthy, but I also really like my candy, so I'm going to include that on the list. And then following that, we asked them to just, debrief. This was the debrief session, like what trade-offs did they have to make? And we, just re-emphasize the need or the importance of nutrition. But then what was really interesting about this activity was that we then said, now you're going to redo this activity, but now you only have $100. You don't have $500 anymore. And what we really wanted them to get at was to realize how difficult it is when you have socioeconomic restrictions to access the healthy foods, which sometimes can actually be more expensive as well. So that was something that we were then able to debrief and discuss. And for this activity also, we had recipes that we had prepared and printed, recipes that didn't require a lot of ingredients to complete, quick snacks that the students, that were age appropriate for them to make as well. And we had them take these home with them. So that was another way to really go beyond the classroom setting. And then on the last day, this is where we focused on policy and advocacy and explained to them what policy is, how we craft bills. And this was really in line with the fact that we had SB 514 bill that we've been hoping as the Lead-Free Promise Project will get passed. And this is a lead poisoning prevention bill that will have children screened at least twice before the age of 2. And because we had talked about screening as a possible prevention tool, we really wanted them to understand that what we're learning here doesn't just stop here, but it has far-reaching implications. And we asked them to write a letter to their legislator. And so some of them wrote the letter to the mayor, and some of them wrote Danine Soresi, and some of them wrote to the House Representative Mike Sturla. So this was actually a process where they sat down, and now they had been working in groups a lot, but now actually worked independently to write this letter to their legislators. So obviously, now that we had delivered that and the 5 days were up and the students had taken both a pre-test and a post-test before, a pre-test before starting the curriculum and a post-test after completion of that program, we actually took the post-test on Thursday because the idea was that on Friday, not a lot of students come for camp, so it was better to capture them on the Thursday afternoon. So we did that on Thursday afternoon. So I'm going to share briefly some of the results that we got out of that. So we had 20 students who were enrolled, and the median age was 12, with the interquartile range from 12 to 13. And most of these students were at the 7th grade reading level. So about 60% of the students were in 7th grade. We did have one student who was, I think 1 or 2 students who were going to 9th grade. So this is the Chicago-led knowledge test, which was developed by Dr. Helen Bean in Chicago. And it initially it had 24 questions. She's since revised it to include 22 questions. And these are the questions. So the first one there says lead paint is more likely to be found in newer homes than in older homes. If you look at the original Chicago-led knowledge test, you might find that the phrasing of the sentences is different. But because I was dealing with a middle school population, I had to make sure that the readability level was within their range. So I've rephrased some of the statements that were in the original Chicago-led knowledge test to suit a readability level for this particular age group. And so those numbers, 4.4, 5.8, 3.7 at the end of each of those statements is actually showing the readability level. There's one there, question 6, that I was not able to bring down. And that's just because the words that are in there have got a lot of syllables, and I couldn't get that down. And I just didn't have the capacity to think about how to rephrase those to make them more age appropriate for this group. So when we looked at the pretest scores, the median score on the pretest was 4 correct responses out of 22 responses. And the interquartile range just went from 0.5 to 9.5. However, at the end of the program, our post-test score was 17. So 17 out of 22 were answered correctly with an interquartile range of 8 to 18. When we ran the Wilcoxon rank sum on this, we find that this is statistically significant. So knowledge acquisition was really good with this particular curriculum that we delivered. When the students had completed the pretest, one thing that did stand out to me was the number of I don't know responses on the pretest. And then at the end of it, there were still some I don't know responses to each of these statements, but what I noticed was that there were fewer. So I decided to, examine this statistically. And what we find is that for 14 of these 22 questions, there's actually a difference in the number or the proportion of students who actually just who indicated that they did not know the statement, right? And it's in favor of the post-test. So there are fewer post-test responses that say, I don't know. And then I asked myself, for those ones where it says, I don't know, how many people actually got the question correct? Let's forget the I don't knows, but let's think about those who actually got it correct. And we find that in the pre-test, for example, for question 11, that's one which showed remarkable improvements, right? Like there was a difference between the number of people who said I don't know in question 11 pre versus post. And when we look at that question 11, we find that in the pre-test, only 12% had answered that correctly versus 87% in the post-test. And for a question like number 16, where this is not different, we find that in the pre-test, 31 had already gotten this correct and 64 in the post-test. And so those differences are more a function of what was the baseline number of correct responses. One thing that did jump out at us was to question what are the responses, what are the statements or the questions that individuals are most likely to get incorrect after the post-test? Because to me, this was going to suggest areas where the curriculum could be strengthened or improved, right? And so, for example, all of these questions post-test had an incorrect proportion of less than 50%. But for question 5 and question 21, we see a 71% incorrect and 78% incorrect. And so for me, question 5, most children have symptoms right away if they have a high blood lead level. And for question 21, most children get lead poisoned by breathing in lead, not by engaging or swallowing lead. And that just tells me that some of those impacts and the sources and pathways are things that we can talk about a little bit more in relation to how we have done it in this first iteration of the curriculum. We also set some attitudinal questions, and remember just thinking about the environmental health literacy and thinking about, knowledge, attitude, skills, and behavior. We had these attitudinal questions, and what we find is pre versus post test, the students didn't feel any differently about their disposition. So really being in this curriculum did not change the disposition that the students had with regards to lead exposure or whether they felt they were at risk or whether they felt capacitated to do anything at all. And again, for me, that's some good feedback in terms of thinking about how can we strengthen and further develop this curriculum. So I think there's obviously need for us to go back and revise and say where are our strengths in this regard, what did we do well, and what are some of the things that we need to improve on. And so having said that, then my next steps or my ideas for moving forward would be to firstly think about a continued review of this curriculum. And I'm very happy to hear from any of you in the room if you have any suggestions on ways that we can address this. Second is to continue to identify these opportunities that might be informal for us to continue to deliver this and to think about those 4 domains of the environmental health literacy. And identifying partners. So I think about Franklin Marshall College that has a science teaching course. And in that course, the students actually are deployed. These are students who are trained in how to teach science topics, and the students are deployed into the different public school systems. And I think about how that can be a good entryway to get some of this information into those schools. So we've already done facilitator training, we have this curriculum. Now we can think largely, how do we partner with Franklin and Marshall College to, especially with that science teaching program, to see how college students can deliver this curriculum in a public school. But also try and think about new partners. moved now, I'm working at Thomas Jefferson University in Philadelphia and don't have the same connections that I had in Lancaster after having been there for a while. I had established some really great partnerships and collaborators. And so now beginning to look to do the same thing within the Philadelphia area. I think it's important in the next steps to think about a longitudinal study that won't just examine knowledge acquisition, but also look at knowledge retention. And we had hoped to do that in this case and have the students who were in seventh grade come in when they come into camp as eighth graders to take the test. But unfortunately, we did not have the same group of students come in. And so our sample size was really going to be skewed and we're not going to have meaningful data. So we were not able to do that longitudinal assessment. So really looking at where are the spaces and the opportunities for us to be able to do a longitudinal study. And our curriculum was not assessing for skill building or behavior change, but maybe this is something that next further iterations can look at both on the short and long term, is how are we going to embed this into a curriculum and how are we going to assess it both in the short and in the long term. So that's the end of my presentation. I went through it really fast, and I think in going through it really fast was not able to express how much fun this was. It was such a joy. I've always avoided middle school students, and it was such a joy to work with them. They're curious, but at the same time, they're independent, right? They know what they want, but at the same time, they don't really know what they want, right? Or what they need to know or need to have. So I really had a fun time working with them. And if I had the opportunity, I would so definitely do this again. I think it's fitting for me to give some gratitude, express gratitude to the different partners and different individuals who supported me. So with the students who've been collecting different pieces of data that I can now put together and showcase 3 different projects. And these students go all the way from a high school level to an MPH or even MD level. Alison Slager helped me develop the curriculum, and she's a medical school student here at Jefferson. And then when I think about partners, Brightside Opportunity Center, property-led inspections, Kate came in and she came in with her XRF on Wednesday morning and she showed the students how a risk assessment was conducted. And, they had a lot of questions for her. The city of Lancaster has been a tremendous support in all the work that I've done. So I always thank them for that. Darren Pam and Alan Treadway were able to help me get that window all sealed up so that it was lead safe, and they brought it to the venue. So I thank them for that. Cribs for Kids gave us the little books, the Happy, Healthy, Lead-Free Me, that they donated them. And at the end of the curriculum on Friday, we gave these books to the children, and it was so nice to see them read. And there was a lot of information that came out at that point. There was one student who's like, "Oh, my mom is pregnant and she would love to read this book," because in the book they feature, I think, a pregnancy as well. So they were generous with that. And then my colleagues, of course, Isaiah, Dr. Ismat, who helped us with the soil sample analysis at FNM, Jennifer Maya and Lauren Howard, who helped with the proposal writing and the curriculum development, and Gail Gettins, who helped us get those books for free. And of course, for the funding, the earlier studies were funded by Franklin and Marshall College internal funds, and the big study on the curriculum development and evaluation that was funded by the Philadelphia Regional Center for Children's Environmental Health. And so, the work is done, but a lot of people went into or committed to getting that work done. And I'd like to thank you all once again for your attention. So if you have any questions,